So simply swap it off. We do have a gentleman here that will help us to demonstrate. Thank you, Matt, for being with us. So patient positioning, it's a key point here because we want to position the patient correctly because we need to get that head as horizontal as possible. So here we're using a chair. The patient could be also in supine position as well. So the idea is to get the head as horizontal as possible. So Matt, if I may just sit a little closer to the edge of the chair. So we have some angle on the patient's back, then there is less angle on the patient's neck, okay? So if Matt is sitting straight up, let's say like this, it's harder to get that head positioning in correct order, especially with some patients that have some neck issues. So to solve that, sit them a little closer to the edge of the chair. The angle on the back will actually solve most of your neck problem patients. So tilt the head back as horizontal as possible. Okay, and do ask the patient to extend their finger forward. So what we're doing is just a pointer to center a patient's eye. Back to the device, 3 fingers on one side, a thumb on the other. Turn the device on, tilt it back. Use the edge of your palm for support on a patient's forehead. Gently pull on the eyelid to make sure the edge of the lid is above the edge of the limbus. You want 1 millimeter of sclera visible. Position the tip right over the tarsus, overlaying it again the sclera. Take the first reading. Don't let the lid slide back, just hold it steady. Position 2, and one more time. 3. Device gives you a long beep. You have -3 on the displayed sequence of readings. It's not the actual IOP. You press the center button, you get the average of the readings, okay? And we're average 13. On the other eye, you're still on the same side of the patient. So if you're right-handed, you want to be on the left-hand side of the patient because you'd be able to rest the edge of your palm on a patient's forehead. So you just clear off the device, turn it back on. You're always starting off with 4 zeros. Back on the same side, get the head as horizontal as possible. I do suggest to use your hand just to push that chin up. I also use another hand just for the support for the patient. The thumb forward. So here I use the index finger to get, or the middle finger to get the eyelid upwards as the eye naturally opens, not to the side. On this side, I use the thumb, similarly getting the eye in the right position. One thing you want to avoid doing, don't let the lid slide onto the cornea. That's the biggest error. You'll get lower results because the device is calibrated for the lid and sclera. 2, 3. You press the button, you get the average of the readings.